I'm just going to go over the behavioral health medications, and this is for schizophrenia. So anticholinergic effects applies to typicals and atypical drugs. So we'll see them in all of them that we were given really. So the patient could have dry mouth, dry throat, decreased urinary output because of the urinary retention, blurred vision, dried eyes, photophobia, constipation, tachycardia. I put the picture that was given to us because I really like that. So nursing interventions for anticholinergic effects, we have the patient chew on sugarless gum, and I have that so raven there. And then we want them to sip water throughout the day to stay hydrated, having an adequate intake of fluids, eat high fiber because of the constipation, avoid hazardous activities. We want them to avoid before taking the medication because of the urinary retention, and then have them exercise regularly. So neuroendocrine, this is seen in typical and atypical as well. That's why I kind of put these two, the anticholinergic and this one next, because we're going to see them in both. So we just observe for these manifestations, and then we would notify the healthcare provider. And the swollen breast is men and women, but it's kind of easier to see it happen in men, because how would you determine if the woman is actually her breast tissue or not? Maybe if you had a patient long term, you could maybe be able to pick up on that. So weight gain, leaking of the breast milk, and then lacking a period. And then that's just a picture of where the prolactin is secreted in the pituitary gland. So this is EPS, and this now we're saying is found only in typical drugs. So another way to describe EPS is basically drug-induced movement disorders. So I listed them here, and I'm going to go over each one. So these are actually other side effects that we see in typical drugs, but some of them also apply to the atypical. So wherever it says both, we'll see them in atypical and typical. And then the other 4 is only applied to typical drugs. So acute dystonia. So this is the spasm of tongue, neck, laryngeal muscle, face, and back. This needs immediate treatment, facial grimacing, and then involuntary upward eye movement. And in this little video here, you can see the patient actually has that involuntary upward eye movement to actually do it. And so we would treat with these 2 meds, and then we monitor the airway because we know that's number 1. And if they're having, laryngeal spasms, they could choke. So we monitor the airway until the spasm subsides. So this is pseudo Parkinsonism, and that man there is giving a demonstration, it looks like, of the type of walk that the patient could have. So slowed movement, rigidity, shuffling gait, drooling, tremors at rest, stoop posture, pill roll motion of the hand, and I put a picture there to show us what it looks like so we could pick up on that if we see it ever. And those are the medications we treat it with. The one that starts with a T is specifically for this, and the one benztropine we'll be using for a lot of these meds for treatment. We want to initiate fall precautions for the patient for obvious reasons. And so this is the subjective feeling of inner restlessness, inability to sit still or stand still, continuous pacing and agitation, rocking back and forth motion, for example. So there's a combination of medications here that we could give, and then the patient is a risk for suicide, so we want to monitor them closely and monitor for any suicidal thoughts. So tardive dyskinesia. So this is a long-term effect, and it's the involuntary movement of tongue, face, such as lip smacking and tongue falsifications, and involuntary movement of arms, legs, and trunk. So there's no reliable treatment for this, unfortunately. So we want to lower the dose or switch to a 2nd generation antipsychotic. And we teach the patient that purposeful muscle movement helps to control the involuntary TD. So this is our sudden high fever that we see in typical drugs, also blood pressure fluctuations, diaphoresis, tachycardia, muscle rigidity, decreased level of consciousness, coma, and this is obviously sounds life-threatening. It is. So we stop the medication, we monitor vital signs, we apply a cooling blanket. These are 2 drugs here that we would administer. We were told we weren't going to be tested on them, but they're still good to see. You never know when they'll come up, and now you know it. So which of the following would the nurse not expect as an adverse side effect from a typical medication? So we're actually looking for which is not a side effect. So we have increased urinary output, bradykinesia, sexual dysfunction, liver impairment. So we know the answer is A because urinary retention, and all the other ones do apply as a side effect. So this typical drug, risperidone, we could give this as a depot injection every 2 weeks IM to the patient, and we'll see therapeutic effects 2 to 6 weeks after the injection. And I just wanted to say, what can we do as a nurse to make sure the patients are taking the medications? Is we could assess the need for case management if the cost of the med is an issue, because I believe these drugs are expensive, and maybe the patient doesn't have the right type of insurance coverage to afford them, and that could be maybe why they're not using them. But it's also typical of schizophrenic patients not to want to take their meds. So that's why we could see them trying to hide the meds. So oral disintegrating tablets could be helpful for those patients, or for patients who have difficulty swallowing. And that little video there is the Z-track method. And then I just put some of the sites to remind us. So now our atypical drugs. So these treat positive and negative symptoms. The typical only treats positive symptoms. So I kind of remembered by turning the T into a plus sign. So then I remembered that the typical is only positive and that the atypical is positive and negative. So we could see a metabolic syndrome. So we want to be checking the glucose and the cholesterol level. Orthostatic hypertension, which I did mention before. The anticholinergic side effects we talked about. I mentioned side effect for both of them. And also for both of them is the elevated prolactin levels and the sexual dysfunction. So this is clozapine, and it's an atypical. And that thing there's actually a white blood cell killing a bacteria. I never knew it really looked like that. So basically the white blood cells are being destroyed as a side effect from this drug. So we want to monitor for signs of infection. We would report to the provider. If it's less than 3,000, we discontinue the med. And this drug has high risk for weight gain, diabetes, dyslipidemia. And ATI also mentioned the side effect of hypersalivation. So these are some interactions that I wanted to mention, because if the patient's on immunosuppressive medications, they shouldn't be taking this at the same time, because we know that their immune isn't good, and to lower the white blood cells even more could be really bad for them. So alcohol, opioids, antihistamines, and other CNS depressions should be avoided. And that applies to all of these drugs. So it's not just this one, it's all of them. For the alcohol, opioids, and the immunosuppressive med seems to only be for the clozapine. So levodopa, it counteracts the effects. That's actually a Parkinson's medication that increases dopamine. And we know that this atypical drug is decreasing dopamine because patients who have schizophrenia have the increased dopamine that could relate to the hallucinations. So if we're giving something that decreases it and then giving something that increases the dopamine, it's just going to counteract each other and not work. So then we have tricyclic antidepressants, should be avoided because this would prolong the QT intervals, thus increasing cardiac dysrhythmia risk. So I'm not really going to say this, but I just put this all of the meds that were used to treat EPS, and I put in the parentheses like what it's used for. And I put the stars next to lorazepam because that's our benzo drug, and we remember that benzos could be misused. We know that they need to be tapered off. because could cause seizures if they're stopped abruptly, and that avoid hazardous activities. So just a refresher on our benzos. So a nurse is caring for a patient who has schizophrenia, and one sec. Okay, so a nurse is caring for a patient who has schizophrenia and exhibits a lack of grooming and a flat effect. So the first thing I think of, okay, so a lack of grooming and a flat effect, that's a negative symptom of schizophrenia. So, okay, I have that in my mind. The nurse should expect a prescription for which of the following medications. Basically, I have the answer already here, but I'm just trying to say, we know we're looking for a negative symptom, and we know that typical drugs only treat the positive because the T looks like a plus sign, so only positive drug symptoms. So we know the answer is the atypical drug. So this one was kind of easy if you could break it down that way. At first I was like scared of it before I seen it, but it's not bad. So that's actually it. So if anybody watched this far, thanks, and good luck on the test.